you or someone you love is living with spinal stenosis, you've probably heard a lot about medical terms that sound overwhelming and sometimes even scary. In this video, I'm breaking down the most common medical options doctors may talk about for spinal stenosis, what each one actually involves, and how they're supposed to help. This isn't about telling you what to choose. It's about giving you understanding so you can ask better questions, feel more confident at your appointments, and make informed decisions at your own pace. Welcome back to the channel. I've been living with spinal stenosis since 2018, and I'm going to share with you 9 medical interventions and explain them and let you know which ones I've had done. First, you'll start out with conservative non-surgical management. This is usually the first phase of care, and let's talk about a few of them under number 1. So physical therapy is to strengthen your core and back muscles. I've had physical therapy, and I've also had physical therapy in the pool, which is called hydrotherapy. So physical therapy is just exercises that they have you do to improve your muscle tone. They could recommend medications to reduce pain or inflammation. I made a video about the top 5 prescribed medications. I'll list that right here in the card. So if you'd like to look at that video. Chiropractic. I've had years of extensive chiropractic. Chiropractic is a natural way of trying to help manage your body. You go 2 to 3 times per week, and the chiropractor will manipulate your spine and try to get it into alignment. And I have had chiropractic. I found that chiropractic did help me tremendously. I don't feel that I would have been able to manage my spinal stenosis without chiropractic. Some doctors will not recommend chiropractic. So chiropractic is something that you can look into yourself and discuss with your doctor. So these type of posture corrections help by making your muscles stronger so that they support your spine better, which can help reduce pressure on narrowed areas. And for many people, this is enough to manage symptoms without procedures. The second medical procedure I will explain is epidural steroid injections. It's when they take a needle. It's used to inject a steroid medication into the space around your spinal nerves. I've had this procedure. What they do is they use imaging, x-ray, or fluoroscopy, and they use it to guide them as they insert a needle into the area around your spinal nerves. The steroid reduces swelling and inflammation around compressed nerves, which can lessen pain, tingling, or weakness. And relief may last weeks to months for some. Relief is temporary. I did have it done, and relief did not last longer than a month for me. It works very well for some people. Third medical intervention that I'll explain is facet joint injections. These are injections that are placed into the small joints between vertebrae. A numbing agent and steroid are injected directly into the joint. Usually this is done under imaging guidance. If your spinal stenosis pain is partly caused by arthritic joints, then this may help by calming those joints and reducing pain and stiffness. The fourth medical intervention that is commonly used, radiofrequency ablation, known as RFA, a procedure that uses heat to interrupt pain signals. They use a probe, is guided near your specific nerves. The nerves stop transmitting pain messages. Relief can last 6 to 12 months or longer until nerves regenerate. Okay, I haven't had that procedure done. The fifth procedure is minimally invasive lumbar decompression, called mild procedure. A small procedure that removes thickened ligament tissue. Hear how it's done. Tiny incision is made. Excess ligament is removed without cutting bone. It helps by removing tissue that narrows the spinal canal, reduces the pressure minimally. I have not had the mild procedure. So the sixth procedure is the laminectomy. With the laminectomy, it's a common surgical procedure for spinal stenosis. The lamina, or the back part of the vertebrae, is removed, which creates more room for nerves, widening the spinal canal and relieving nerve compression, which can improve walking, tolerance, and pain. The seventh procedure is a laminotomy. This procedure is a partial version of the laminectomy. So with the laminotomy, only a small portion of the lamina is removed, and this preserves more of the spine structure, relieves nerve pressure while maintaining spinal stability. 8 is this discectomy. The discectomy procedure is removal of all damaged disc material, and it helps by stopping disc material from pressing on your spinal nerves, and it reduces radiating pain, numbness, or weakness. 9 is a spinal fusion. Fusion is a surgery that permanently joins two or more vertebrae. Use some metal hardware, which will be some metal screws and plates that stabilize your spine, and it's often done when instability is present. If you're living with spinal stenosis, I hope this helped make your options feel a little clearer and a lot less intimidating. Remember, this isn't about rushing into decisions. It's about understanding what's available so you can have informed, confident conversations with your care team. Every spine is different. Every journey is different. And you deserve care that fits you. If this video helped you, save it, share it, and drop your questions in the comments. You're not alone in this, and you don't have to figure it out by yourself.